Hello and welcome to Advanced Health Assessment and Differential Diagnosis. This is the first clinical rotation that nurse practitioners will experience in their nurse practitioner education and training. Here at Washburn University, we require prerequisites before this course. As you know, BSN prepared nurses often have many of the same classes, such as pathophysiology, pharmacology, and advanced health assessment. However, they're at the BSN level. At the graduate level, they take these courses as well, but with a higher degree of difficulty to enhance and build on their critical clinical thinking skills. These students will have had pathophysiology, advanced pharmacology, their previous years of experience working as a nurse, an RN, BSN prepared, and of course, their BSN education. The course structure is set up in different ways to help build a foundation of good history taking, physical exam, as well as diagnosis and differential diagnosis. Initially, before advanced health assessment, so the semester prior, the students will come to campus for a pre-skills checkoff. They are offered and enrolled in a free course that helps them develop performing a physical exam head to toe. They come to campus, perform a physical exam on a standardized patient that observed by faculty. This gives us a baseline of their skill set, and it helps us design advanced health assessment coursework for the spring semester. Advanced health assessment has concurrent lecture as well as practicum. This means they have lecture throughout the semester as they have the clinical rotation. They are expected to experience 105 hours in a clinical setting. The WECAN trainee students are expected to receive training and education in a rural setting as well as a medically underserved population. Their experiences need to include ER, hospital, urgent care, and hospital care, as well as the family practice setting. They also have a skills checkoff during the courses. These are opportunities that the students record themselves, video and audio, performing certain exam skills. Then these are uploaded to our server for the faculty to view and provide feedback to help them improve their skills. At the end of the semester, the students then come to the on-campus experience for an objective structured clinical examination, or an OSCE for short. This is where we have a standardized patient and the student performs a history physical and developing a diagnosis with differential diagnosis. This is observed and graded by the faculty member. We also utilize iHuman case studies. These are in the online classroom, and they're a low-risk way for students to learn critical thinking skills in a clinical setting. We also help them with their documentation. The pre-skills checkoff occurs the semester before advanced health assessment. Once again, this is a head-to-toe physical exam and provides us with a baseline. It's not for a grade. and it's during the on-campus experience. This helps the faculty and the student to identify learning needs. Once again, it's before advanced health assessment. It's a head-to-toe physical, provides us with a baseline. It's not for a grade, and it's during an on-campus experience. The OSCE utilizes standardized patients. The student will perform an exam, a history and physical, and formulate diagnosis and differential diagnosis. It's during the on-campus experience. It's part of their final grade for the course. It's heavily weighted in history-taking skills and exam skills. And then the diagnosis and differential diagnosis. Plan of care, not so much. That's for later courses. The iHuman cases are simulated to teach critical clinical thinking skills in a low-risk environment. The course outcomes for advanced health assessment: perform a skillful, organized patient history and physical exam across the lifespan. Demonstrate clinical reasoning using evidence-based practice guidelines to interpret health history data and physical exam findings to formulate differential diagnoses. Identify differential diagnoses based on assessment data, including functional and/or developmental assessment appropriate to a patient's age. Construct rational treatment plan based upon diagnoses. Implement correct diagnostic techniques specific to body systems and age. Appropriately and concisely document initial, recurrent, or episodic patient assessments. Maintain patient safety and privacy during the patient encounter. Perform clinical procedures and diagnostics. Because the lecture content is concurrent with the practicum, we've given you a list of the modules in order so that you may better plan the semester with the student. The recap. Remember, this is the first clinical rotation for the NP student. They come to you with various backgrounds and experiences. Lecture content is concurrent with the clinical rotations. Therefore, they should spread the 105 hours up over the semester. They have varying levels of proficiency. Think of them as novice or beginners in most areas. They will focus on performing histories and exams to arrive at a correct diagnosis. And they'll have a variety of clinical background experiences. Thank you. And remember, preceptors are a valuable part of NP education.